From puppy paws to menopause. Menopause. It kind of dared me to say it, but I thought it was cute.
You think that worked?
I think so.
Okay.
It's Friday.
Yeah,
Let's live a little.
Why not?
You know, menopause marks a really important health transition in a woman's life. It comes with a wide range of symptoms, from hot flashes to brain fog. And until recently, menopause was not a topic that was widely discussed by patients or providers or policymakers.
But last week, the new FDA commissioner convened a panel of experts to discuss menopause and hormone replacement therapy.
But as a result of the fear of breast cancer, 50 million plus women have not been offered the incredible potential health benefits of hormone replacement therapy.
Okay, so there's just a little clip from this. Legislators in 13 states have introduced bills now focusing on menopause care that could reshape insurance coverage and medical training. So what do you need to know about this?
Our KSTP medical expert, Dr. Arkel Georgiou, is here to explain. Doctor, thanks for joining us.
Sure, this could be a whole show.
I think it could be.
Yes.
Let's just start with the definition of menopause.
Let's start with the definition of perimenopause and menopause and postmenopause. So perimenopause is the moment in a woman's life when her ovaries begin to decline in function. They stop making less estrogen. That occurs in the mid-40s. It can last on average 3 to 7 years. Hate to tell you this, but those symptoms can last for decades. Menopause is the moment at which you have not had a menstrual period for 1 year. Menopause lasts for 1 day. Postmenopause is the rest of your life after that.
Oh, that's funny because everyone says menopause and you assume that it's this duration of time.
All-inclusive.
It's the 1 day.
Yes.
Okay, so I feel like there's a lot more talk about perimenopause and menopause today, and maybe it's just because I'm kind of getting of age. Was there something that happened? Because my mom didn't talk about it. Her friends didn't sit around discussing it, but I feel like in every chat room that I'm on, other moms are like, oh my gosh, help me with this, and what are you doing for this?
It's a huge topic, and women have been suffering in silence for years. Let's get that straight. And 73% of women are not getting treated for their symptoms. And that's been going on for a long time. So why is it a big topic now and a big source of investment, actually? It is an economic issue, and here is why. We're getting older as Americans. We know that, we're living longer. There's more women that are perimenopausal, postmenopausal in the workplace. The symptoms are affecting them, and that is affecting the workplace. Women are having career changes because sometimes they just can't handle being in the workplace with those symptoms when they're untreated. So it's become a business issue.
So I don't know if this came out last week or in the last couple of weeks. It had been widely accepted that hormone replacement therapy could increase the risk for cancer or a stroke or something.
And heart disease.
Yes. But that information is now being kind of walked back. To explain how, and that's a soundbite that we heard at the beginning of the segment.
Yes.
Explain that.
Yes. So I need to do a little history lesson here. There was a very large study called the Women's Health Initiative that was started in the late 1990s. It was abruptly stopped in 2002, almost exactly 23 years ago today. I think it was July 9th, 2002. Stopped, and there was a big press release that said, hormone replacement therapy increases the risk of breast cancer and heart disease. Messages went out to doctors and patients across the country that said, you should stop this. And they did. There was a 46% decrease in the number of women who stopped using that therapy. And that's what happened. So all these people went off of it. But that was a misinterpretation of the data. And in 2013, all of the data and a look back was done, and they saw that, nope, the analysis was wrong. And hormone replacement therapy can actually be safe and helpful for some women in a certain age group. Within 10 years of menopause, between the ages of 50 to 59, absent of other risk factors, so that's a very personal decision. But unfortunately, that didn't make much of the headlines. And so we remember the doctors and patients, everybody, including maybe even you, Chris, as you introduce that, remember the headlines where it causes breast cancer and heart disease, and don't remember the reanalysis and the new insight That's actually now
Why
over
didn't
12
in
years old.
2013, when that sort of got I don't want to say reimagined, but when it was re-examined at that point,
Yes.
why didn't then that sort of permeate through the medical community?
So, there's probably lots of reasons, but when hormone replacement therapy became unsafe and a cause of cancer in 2002, medical schools stopped talking about it because it wasn't, you're not going to train on something that's going to hurt
that
women.
makes sense.
That makes sense, yeah.
And actually, there is very little education in medical school curriculum. I don't remember any at all, and I don't think that it exists today, even in medical school curriculum. But even in OBGYN residency training, there's only a few hours, if any, of training or curriculum around menopause.
That's so crazy because every woman will go through it.
This is
wouldn't,
correct.
not every woman will birth a child, but every woman will go through this and there's not any training on it?
And that's why there's legislation that's being introduced, so that the state medical boards in some states are beginning to require continuing medical education for doctors in their states to get more menopause education.
Okay, so let's talk about women who may be in this age range of perimenopause, right, and postmenopause. How do you know if hormone replacement therapy is right for you? At what point do you talk to your doctor about this?
You talk to your doctor when you're having symptoms. And symptoms, the very earliest symptom, the very earliest, is change in the pattern of your menstrual periods. They can be lighter, they can be heavier, they can be shorter, they can be longer, whatever it is. That is the very earliest symptom. And then what happens after that, 80% of women had hot flashes, but other common symptoms are the brain fog, thinking like you can't concentrate. There's a lot of sexual symptoms, low sexual libido, urinary symptoms, vaginal symptoms, and lots of mood changes, depression, agitation. So if you're feeling any or all of those things and you are in this age group, you should have a conversation with your doctor. What you should not ask your doctor for is having them check your hormone levels. Total waste of time, total waste of money, because your hormones fluctuate every 90 minutes. It's not going to give you information, and too many doctors are checking their patients' hormones, ka-chink on the, on the bill there, and they're saying, "Oh, your hormones are fine. You don't need anything."
You're not
right.
going through these symptoms yet. You're not
Exactly.
perimenopausal.
And that is what the FDA experts were talking about during their 2-hour session last week, is that is one of the just the wrong approaches to care, is that hormone levels are being checked, useless, but they're using the hormone levels to tell women that they don't need treatment.
So will this be, will some of this stuff be covered by insurance that wasn't in the past?
Well, a lot of menopause care is already covered by insurance.
Okay.
If it is prescribed, it's generally covered. Here's what is not covered because it's not approved by the FDA. So testosterone is a hormone that we know exists in men, but it also exists in women. It's made by certain endocrine glands, including the ovaries. So when the ovaries stop functioning, women lose testosterone. It is not just for sexual desire, it is for other bone building and other effects as well. There is no testosterone formulation for women that is FDA approved on the market. Many doctors approve it off-label. It can be prescribed, but it's not covered by insurance because it's not FDA approved. And that may be one of the things that really changes at a federal level.
Do you think the conversation in doctors' offices changes now after this?
Well, I sure hope so. But the other place, yes, because women are beginning to get more educated, more informed, advocate more for themselves. We're seeing it more on the news, like we are talking about it today. But I also think it's becoming more of a topic of conversation with employers. So yes, you can be prescribed certain things that can certainly help your symptoms, but your employer, your workplace can do certain things in terms of the temperature regulation in the office, what they require you to wear, not wear when you're in the office. There's accommodations that your employers can make, so you can talk to HR. And talk to your partner. So many women are not talking to their partner about the symptoms and what they're suffering with. And so, yes, talk to your doctor, absolutely, but talk to your employer, talk to your spouse as well.
Good advice.
Dr. Giorgio, thanks for stopping by.
you.
Good to see you. For more medical news and how it impacts you, check out Dr. Giorgio's podcast. It's called Speak Up for Your Health. We'll post a link for you to the episodes at minnesotalive.com.